Sentinel AI, transforming behavioral healthcare through intelligent clinical infrastructure. Executive overview. Sentinel AI is an AI-powered behavioral health infrastructure platform designed to modernize psychiatric assessment, crisis intervention, clinical documentation, patient engagement, and evidence-based decision support across inpatient, outpatient, emergency, telehealth, correctional, community, and integrated healthcare environments. Behavioral healthcare systems globally face a critical challenge. Clinicians are overwhelmed by rising patient acuity, staffing shortages, documentation burden, inconsistent screening practices, burnout, and delayed treatment decisions. In many healthcare environments, evidence-based screening tools exist but are underutilized due to workflow inefficiencies, time constraints, fragmented systems, and provider fatigue. Sentinel AI addresses this infrastructure gap by creating a unified, intelligent behavioral health ecosystem that standardizes clinical screening, automates workflows, supports diagnostic precision, and improves patient outcomes in real time. The problem in behavioral health care. Behavioral health providers today are expected to conduct multiple psychiatric screenings manually, interpret complex symptom presentations, document encounters extensively, identify suicide and violence risk rapidly, monitor withdrawal syndromes safely, coordinate care under severe time pressure, manage increasing patient volumes, maintain evidence-based compliance standards. This results in provider fatigue and burnout, inconsistent use of validated screening tools, missed diagnoses, delayed interventions, increased liability exposure, documentation inefficiencies, reduced patient engagement, poor continuity of care. The current system is reactive, fragmented, and heavily dependent on clinician bandwidth. Sentinel AI solution. Sentinel AI introduces an intelligent behavioral health companion platform capable of administering, interpreting, documenting, and organizing evidence-based behavioral health assessments in real time. The platform acts as a clinical intelligence layer that supports, not replaces, licensed clinicians. Sentinel AI enables healthcare organizations to standardize behavioral health screening workflows, improve diagnostic accuracy, reduce clinician cognitive overload, accelerate treatment planning, improve patient safety, enhance evidence-based decision-making, reduce operational inefficiencies, improve compliance and documentation quality, evidence-based assessment, infrastructure. Sentinel AI integrates validated behavioral health screening tools directly into clinical workflows. Examples include depression and mood disorders, PHQ-9, Beck, depression inventory, mood disorder questionnaire, MDQ, anxiety disorders, GAD-7, HAM-E, suicide and safety assessments, Columbia Suicide, severity rating scale, CSSRS, SAFE, T, framework, suicide risk stratification, PTSD and trauma, PCL-5, ACE screening, psychosis and schizophrenia, brief psychiatric rating scale, BPRS, PANSS screening workflows, substance use and withdrawal, COWS, CIWA, AOSM criteria support, ADHD and neurocognitive screening, adult ADHD, self-report scale, ASRS, mini mental status workflows, OCD and behavioral disorders, Yale-Brown obsessive-compulsive scale, IBUKUN. Why evidence-based tools matter. Evidence-based screening tools create consistency, objectivity, and measurable outcomes in behavioral healthcare. Sentinel AI ensures these tools are administered consistently, properly interpreted, automatically documented, trended longitudinally, embedded into workflow, accessible in real time. This allows clinicians to make more informed decisions using standardized clinical data instead of relying solely on subjective observation under time pressure. The result is earlier identification of psychiatric deterioration, improved diagnostic confidence, safer medication management, faster intervention pathways, improved continuity of care, reduced variability in treatment approaches, reducing provider fatigue and cognitive overload. Behavioral health clinicians are experiencing unprecedented levels of burnout due to excessive documentation, administrative burden, staffing shortages, emotional exhaustion, constant multitasking, complex patient populations. Sentinel AI TM reduces this burden by automating screening administration, auto-scoring assessments instantly, generating structured summaries, assisting with clinical documentation, organizing risk indicators, highlighting pertinent findings, supporting treatment planning workflows. Instead of spending valuable time manually scoring tools, interpreting fragmented data, and documenting repetitive information, clinicians can focus on therapeutic engagement, clinical judgment, patient safety, human connection, care coordination. This transforms behavioral healthcare from documentation-heavy workflows into patient-centered care to delivery. Inpatient behavioral health impact. In inpatient psychiatric units, Sentinel Ai TM can assist with admission behavioral health assessments, identify suicide and violence risk early, monitor withdrawal syndromes continuously, track symptom progression daily, improve crisis response workflows, support nursing and psychiatry collaboration, standardize rounding assessments, reduce delayed interventions. Benefits include faster stabilization, improved patient safety, better interdisciplinary communication, reduced adverse events, improved discharge readiness. Evaluation, outpatient and community behavioral health. Impact. In outpatient clinics, FQHCs, telepsychiatry, and community mental health systems, Sentinel Ai streamline intake workflows, improve triage efficiency, identify high-risk patients earlier, support medication follow-up monitoring, improve continuity across visits, enhance telehealth behavioral assessments, improve patient engagement through conversational AI support. This enables higher patient throughput, better treatment adherence, improved quality metrics, reduced missed psychiatric deterioration, more efficient provider workflows, clinical decision intelligence. Sentinel Ai TM does not replace clinical judgment. It enhances clinical decision-making through real-time behavioral health insights, risk stratification, longitudinal symptom tracking, structured clinical summaries, evidence-based workflow recommendations, intelligent escalation pathways. This creates a safer and more intelligent behavioral health infrastructure where clinicians are empowered with actionable data instead of fragmented information. Strategic value to healthcare systems. Sentinel Ai TM provides measurable enterprise value by reducing provider burnout, improving operational efficiency, supporting quality metrics, improving behavioral health access, enhancing patient safety, improving documentation, consistency, supporting accreditation and compliance standards, reducing liability risk through standardized assessments. Healthcare systems increasingly require scalable behavioral health infrastructure solutions. Sentinel Ai TM positions organizations to meet growing psychiatric demand with intelligent automation while maintaining compassionate care delivery. The future of behavioral healthcare. Sentinel Ai TM represents a shift from reactive behavioral healthcare toward proactive, intelligent, evidence-based psychiatric infrastructure. The future of behavioral healthcare requires intelligent screening systems, standardized evidence-based workflows, AI-assisted clinical support, burnout reduction infrastructure, real-time risk identification, scalable behavioral health operations. Sentinel Ai is designed to become the operating intelligence layer for modern behavioral healthcare systems globally. My name is Dr. IBUKUN ODUTOLA, and I am the founder of Sentinel Ai, an intelligent behavioral healthcare infrastructure for the future of mental health, brought to you by DIL Organization, Health Tech Innovation Company. Website: .drabeslux.org.